The Delta variant of COVID-19 is threatening the country's busiest metropolitan area. Joining us now is Guido David, who is with the independent COVID-19 research watchdog, OCTA. Good morning, Professor David. Welcome to this special edition of New Day.
Yes, hi, good morning, Mai, and to our viewers and listeners.
Professor, you've been analyzing COVID data and research since the start of the pandemic. And of course, it's Sauna Day. This is the time that we take stock of what has been achieved and what else should be done. How would you assess the government's pandemic response, and how would you compare our situation now with last year?
Well, to be honest, in the initial phases of the pandemic, the government's response was, let's say, it was needs improvement because, as was mentioned in some of your highlights, the initial response was a bit well. It was not the best response. We needed testing early on. We needed contact tracing, and our hospitalization was not scaled up. As we move towards 2021, the government response has improved significantly. And I would say that because, I mean, of course, we have the longest lockdown, but we have also managed to save lives. Our healthcare system has improved. We can see that because the case fatality rate has also improved significantly. I must admit, I wish we were able to contain the surge in March, especially since it was sort of forthcoming. But since then, we have also improved testing. We have added several more laboratories. Our testing is adequate by international standards, going by COVID Act now. And then our contact tracing, well, we seem to have scaled it up, at least in the NCR. Of course, testing in many parts of the country is still in a way lacking because of the high positivity rates that we're seeing in many of the regions in the country, right?
Professor, let's talk about the vaccination program. Where do things stand for us as our vaccination efforts are gaining ground? And let's talk about herd immunity. When do we expect to achieve that?
Right. For vaccination, the initial rollout was also lacking because it took us a while. Well, of course, the reason was the global supply chain. So most of the Western countries were actually having preserving the stocks of the vaccine. But now that the rollout is going satisfactorily well, at least the acquisition, the rollout is actually pretty good considering the acquisition. And we have already vaccinated, I think, about 20% of the population in the NCR. And this is a significant milestone for me, particularly, because we have seen in many countries in the USA, in the UK, that when we reach 20%, there's a significant effect already. We're not yet at population protection, and we're not yet at herd immunity, which would require maybe 80% or even higher to vaccinate. 80% of the entire population. But we might not get to that this year because of the challenge of vaccinating children and adolescents. Most of the vaccines are not yet available for them. So the goal is to achieve a level of population protection, which is about 40 to 50% of select regions, especially the high-risk areas that includes NCR, Cebu, Metro Cebu, and Davao City.
Professor, okay, all eyes are on the Delta variant. Just last Friday, the Health Department confirmed that there's already local transmission of this highly transmissible variant. And based on your analysis, nararamdaman na po ba natin ang full impact of the Delta variant? How much is it adding to the cases?
Yes, according to the census, if we go by sampling, that would account for about 15% of the virus in the country. The Delta variant would account for about 15%. It could be higher, but that's the sampling, just the sampling error. And regarding your question, hindi pa natin nararamdaman yung full effect the full effect, like what we're seeing in India, like what we saw in India and what we're seeing now in Indonesia and Thailand and Vietnam. But we are feeling some of its effects because now we're seeing a resurgence in Cagayan de Oro. It's a critical risk area now, and Cagayan de Oro is one of the places where the variant was found. We're starting to see the initial phases of a surge in the NCR, and we're also seeing a surge, an ongoing surge in Cebu City. And so those are three areas where we think that the Delta variant is making its presence felt. Of course, in the NCR, it's in the early stages, and we support the decision of the government to impose a stricter quarantine, which is the GCQ with heightened restrictions. We hope that this will mitigate the further spread of this Delta variant in the NCR.
Stay safe, Professor, and thank you for joining us this morning. OCTA